Today, we are joined by Jonelyn Langenstein. Jonelyn is a speech pathologist practicing at Northwestern Medicine. Her clinical expertise includes the evaluation and treatment of voice, upper airway, and swallowing disorders, including but not limited to professional performing voice, gender affirming voice, aging voice, respiratory restraining, and much more. In addition to her work in speech pathology, she's also a former opera singer. Thank you so much, Jonelyn. We're so excited to have you on today. And I was hoping just to sort of kick us off here, if you could give everyone a brief synopsis on what is speech pathology and what do you do to help your patients?
Thanks for the intro and for inviting me to be here today. Yes, so speech language pathology, as we say, we deal with communication and swallowing disorders throughout the lifespan. And so we always say that the term is from birth all the way till death. So we can deal with, little babies that are born premature and having difficulty eating and swallowing, all the way to geriatric patients that are end of life and having dementia issues and also swallowing issues there, and then everything in between. My perception of a speech pathologist used to be, oh, it's just someone who helps kids pronounce words, but it's so much more than that. My specialty in particular is dealing with adults with voice difficulties, upper airway disorders, and we consider that to be chronic cough, and some other upper respiratory breathing issues that are of a behavioral component, as well as swallowing. So, for example, I used to work with the head and neck cancer population. A physician says you have to have your tongue removed because there's cancer in the tongue. And then I would potentially help that person rehabilitate both their speech and swallowing, help them find the least restrictive diet. And so that's kind of my niche within speech pathology. But when somebody goes to get a degree in speech pathology, then they learn about everything across that lifespan, and then we all eventually subspecialize.
Interesting. I really didn't know about the sort of rehabilitative practice of speech pathology. So in our research on you, we learned that you are a former singer and probably a current singer too, and that you even work with singers. So I would love to hear more about your background in singing and maybe how that informed your career choice into speech.
Yeah, so I grew up singing in choirs and loving performing. I took voice lessons. And in undergrad, I actually was put in an opera scenes program. And I actually had a voice teacher that I think saw the talent in there before I did. And basically, she was able to determine that I had untapped potential, especially in the high, what we call coloratura repertoire. So being able to sing very high, very fast, if you've ever heard like Queen of the Night and that sort of thing. And that's the music she gave me. And from that point on, it was very clear that, wow, like there's really something there. And eventually I decided to go to grad school, pursue a master's in music at New England Conservatory. I became a New England based singer at the time and was doing a lot of performing chorus for big companies, main stage roles for smaller companies, a lot of performing around the New England area. And then I started to have some voice issues. Actually, this was around 2008, and I started to have some voice difficulties. My master teacher at the time, Carol Haber, said, I think you might have this muscle tension thing going on. And I don't think I have the tools to help you necessarily. So maybe you should go to the MGH Voice Center and get evaluated. And I really had a bad attitude about it, I'll say. I kind of thought it was going to be a little bit of a waste of time. The speech pathologist was going to have no idea how to help me. And the laryngologist evaluated me and said, yes, I think you should see our speech pathologist. I started to work with her. And it became very clear quickly that, wow, she really understood the voice mechanism. She was a former singer herself. She could play piano better than me. She knew all of my repertoire, and she definitely had the tools to help me because she understood my demands as a singer so intimately. And it was really, that was the turning point for me. I was ready to do something besides sing professionally, but I just didn't know what I wanted to do and how to invest my time and energy. And from that point on, I said, I know what I want to do. I need to go back to school. And that started the whole process of working towards being a speech pathologist, a voice specialized speech pathologist. And then here we are.
Jonathan,
So
if I may ask, I guess how when you when you say that you started to have voice issues, how did that manifest in like your singing, your speaking? Was it affecting your, the way you sang and the way you talked? How was that manifesting for you?
Yeah, it was very singing specific. I
Mm-hmm.
can't remember if there was maybe some speaking voice subtleties that was going on at the time, but as I said before, I'm a coloratura soprano, so I need to be able to sing very high, very fast,
Yeah.
and especially the fast stuff. It's called coloratura for a reason. It's just like these florid passages where you have to go from note to note and all over the place very quickly, and that became really difficult for my voice because of the tension that was going on. So you can just picture like
Mm-hmm.
throat is a tube. I always say it's like a tube, like an upside down L.
Yeah.
And if the tube becomes too tight, then the mechanism just can't be optimized. It's not as flexible, it's not as
Mm-hmm.
fast. And that also changes the breath. And that essentially the muscle tension can weigh the voice down. So you can't perform optimally because of that tension. And so it just like it sounded, if we were to analyze just like how it sounded in the moment, it sounded uneven, it didn't sound
Mm-hmm.
easy. I was very fatigued when I was singing. I started to avoid some of that repertoire, so I was like, well, I don't want to sing that anymore.
Yeah.
I started to, like, then you obviously don't get the auditions, you don't go for the auditions, or you don't get the gig. Afterwards you're like, that didn't go very well.
Yeah.
um,
Is that sort of how you came to the decision that, singing may not be the path forward in terms of a professional career for you? Or were there other factors in that decision?
Oh, it's a good question. I mean, I think I myself at the time, I was just so passionate about singing. I thought I would be on the stage of the Met by age 25. And, I didn't anticipate there being any issues with my singing voice. So I think if the
Mm-hmm.
mechanism had been working well, I think I probably would have taken it a little bit further. But at the same time, the economy was just doing so poorly. And all of the all the singers go to New York. It's always in the fall, and all the companies go there and they audition singers. And it was a bad year for the economy. And so a lot of the opera companies at the time were pulling back. They weren't doing as big of productions. They weren't hiring as many singers. So there was just less work for everybody.
Okay.
And I at least just made the decision, like, well, would be a good year to woodshed. This would be a good year to work on my voice, to get in really good shape for the next season. At the same time, I also had a decent day job. I was working for the government in Massachusetts at the time, and so I
Mm-hmm.
had a 401k. I had health insurance. I was like, ooh,
Yeah.
this is kind of nice. I kind of got comfortable enough. I was like, is it worth it to quit my job with all of my benefits to go sing a 3-week gig somewhere and then have to start over again somewhere else? So that lifestyle was getting tiring.
Yeah. It's interesting because I actually was going to ask you, I feel like a career in opera singing or, even just like singing in general, I would categorize that more in like the alternative career path type. But it's interesting you say that you also had a day job or like
Mm-hmm.
a 9 to 5, so to speak. So
Yeah.
how did you get comfortable with like, I don't know, was there any uncertainty going into like a non-traditional path at first?
You I was surrounded by other performers at the time. It's just kind of the gigging lifestyle. So everybody is very comfortable with that. It sounds scary to other people that are always in the day job profession,
Yeah.
but at the time, everybody else is waiting tables, everyone else is um, living gig to gig, and you're supplementing your own career as you're going financially. So it didn't feel strange at the time. It is something that it gets to you after a long period of time. I mean, that was me in my 20s. I can't imagine, like having to support a family,
Right.
or a mortgage and stuff like that. Your priorities just start to shift as you get older. I knew I wanted to be in California. My family lived there. I wanted to be closer to them. And so kind of
Mhm.
the answer to all of my problems was like, I need a new career path. I want to get back to the Bay Area. And I was just kind of waiting for what life to reveal itself of what the next step forward was going to be. And I still sang
Mm.
when I was in graduate school. I went to San Francisco State for my master's in speech pathology, and I had a lot of Bay Area connections, so I was able to keep performing to a certain extent. I have less connections in the Midwest, but my priorities have shifted. But it's, you know, I've invested a lot in my voice before, so we have to keep using it to a certain extent.
Yes, definitely, definitely. It
If
seemed
I
like
may jump in. Oh, so sorry. You go ahead.
no, I was just gonna say, using your voice, I think, like, was the speech pathology, did it seem like a natural, like organic next step for you?
I wouldn't say it was, just because I had no idea what speech pathologists do up until that moment. You know, I was just kind of blown away. I was like, wow, I could really help somebody, because I understand the voice mechanism more intimately than anyone. And then because of my strong interest in that, then grad school was, you know, even though I had to study all these other things, it was very focused on that. So yeah, I don't know what the ironic thing, that this is just like a quick story, is I took some sort of personality inventory in high school. There was this test that we had to take to predict like what job you would do well at, and you take some Scantron test and it spits it out. And I remember looking at the report and seeing the first thing, because I really liked animals, and the first thing on the report was forest ranger. And I was like, well, this was a waste of time. And I didn't throw the piece of paper away. I just put it in some box. And then years later, this was maybe 5 years ago, I was going through some of my stuff my parents said I had to get rid of. And I found that report again. The second thing on that report was speech pathologist.
No way.
Isn't that crazy?
This is such a full circle moment. Wow.
So I had a quick question. Going to Northwestern, I have a lot of friends in the theater program and in the musical theater program. And I feel like I always see them doing different things to help their voice. So they're drinking hot tea, or they're taking like spoonfuls of honey, whatever it is. I was wondering, from like a health and wellness perspective, what are some things you would recommend to my friends or other people in the musical industry who are singing and using their voice a lot in order to maintain their best health?
It's a great question. Well, first of all, Northwestern, we have a screening program for the undergraduates, the brand new undergraduates, for them to come in and get a well baseline. We evaluate them and look at their vocal folds to make sure they're looking healthy, and they're able to get some information on that throughout, to support them throughout their career, and then they can always refer back to that. So anyone who's thinking about going into musical theater professionally should obtain a well baseline and figure out who their team members are. What I talk to a lot of musical theater performers about is vocal budgeting. It's this idea that, you only have so many vocal dollars to spend throughout the day, and musical theater people are often in shows, multiple shows. They're also very social. Some students are working jobs at the same time. And so it's pretty easy to outspend your vocal budget. Undergrad is a really fun time. People want to stay up late. They want to do all these things, but the voice is not always capable of doing all things. And I'm not saying people have to be on voice rest all the time, but just being mindful of how are you balancing voice on and off time? And if you're starting to notice change, then something in your daily life has to change. And I always say, listen to your body. Your body is wise and will tell you. And that could be a sound thing, a quality of the voice thing. I can't sing as high, I can't sing as long. Or it could be a feel thing. Oh, it feels a little rough and scratchy. That hurt, that was uncomfortable. It's your body's way of telling you might be outspending. And if that's happening obviously too much, then you should come in and see us and consult a voice team. Or it could just be as simple as pull back, take it easy, I'm a little bit sick. Don't push your voice during that time period. So that's kind of the best piece of advice. I could throw out like a million other tidbits, but if I was to choose one thing, listen to your body. It's going to tell you, don't overspend.
A good piece of advice.
And that's true for everybody. I mean, everyone is a vocal professional at the end of the day, whether you're a lawyer, you're a doctor, your voice is really important. It's how you convey the information to do your job. It's not just singers. So the same piece of advice can definitely apply.
Yeah, it seems like it's the same as for an athlete. It's like their muscles, they need rest, they need recovery, they need a break. So you're using your voice all the time. It's like, it's, you don't think about it, but it's like you need to be mindful about, I guess, conserving it in a way, it seems.
Yeah, spend it where the dollars really need to be spent. Oh, I have to do this show. Oh, I have to do my job. I have to communicate with my family at home.
Right. So, Jonelyn,
Going
I
off of
know
that,
you say that
sorry.
you like your specialty really is like the rehabilitation side of things. I know it probably depends on this question, like depends on the severity of the person's like vocal issues once they come in, or throat issues once they come in to see you. But how long would you say you typically spend? What does like a typical therapy timeline look for the patients that you have coming in?
Yeah. So when somebody has a voice problem, the process is that they come in, see a laryngologist and a speech pathologist on a joint clinic. So
Mhm.
that looks like a visit where the patient comes in the room, we get their history, what's been going on with your voice, and we make a recording of how they sound that day. And then we have two different ways to look at the vocal folds because we have to look
Mhm.
and make sure because people can have muscle tension issues, kind of like I had. People can have cancer in their throat, right?
Mhm.
So
Mhm.
we can't make any assumptions. We can make an educated guess as to what's going on, but we do have to look. And so an exam would be performed either through the mouth using a rigid endoscope that has an angled lens that looks down at the vocal folds, or we put some decongestant and numbing in the nose, and then we pass a scope through the nose with a camera to look at the vocal folds that way. We record it, we test their voice doing various tasks. We have a whole protocol we go through to just examine comprehensively what's going on with the vocal folds. Then we play it back for them. We discuss the findings, and we believe strongly in the interdisciplinary model. So that way, I bring the behavioral perspective, the laryngologist would bring the surgical and medical perspective, and we're managing the patient holistically.
Mhm.
And if voice therapy is indicated, which it is in a lot of cases, sometimes it's like, nope, there's cancer, you got to go get a surgery, get it taken out, right? Like,
Mhm.
but other times it's like, wow, like we're seeing these subtle changes, and we can bring that inflammation down if you're changing your behaviors, or you're going to need a surgery, but you're going to need a little bit of recovery with your voice. We don't want the what we call phonotraumatic or injury that occurred because of your vocal behaviors. We don't want that to return, right?
Mhm.
So I sit down with the patient and look comprehensively at their vocal behaviors. How did it lead up to what's going on? How do we ensure that doesn't happen again? A
Mhm.
typical course of voice therapy is 4 sessions typically, and they
Okay.
come in for 50-minute sessions. I also do telehealth. So we just log on at the same time, do telehealth sessions. And if people are good homework doers, and they're responding well with the therapy, typically we're done in 4 sessions.
Wow.
It's gender affirming voice work. The process is a little bit longer.
Okay.
Typically we're doing about 10 sessions of the therapy. And over time they're learning how to modify their voice. And sometimes it is back and forth with the surgeon. I can only get them so far therapeutically, and then I'm circling back with the surgeon, and we're weighing, what should a timing of a surgery be, and what makes the most sense. How's this person going to respond?
Right.
And that's the beauty of an interdisciplinary clinic working together.
Yeah. 4 sessions, like I would think it would be much longer than that. It seems like surprisingly short for some reason.
Yeah, I mean, I've worked in 3 major voice centers at this point, and it's pretty typical, assuming patients are, I have to help people build awareness as to what's going on, and then it's just about making a change. It's about changing ergonomics of the way you're using your voice,
Yep.
and self-awareness is half the battle. If people can't recognize it, then that's that can be a little bit challenging. But then once people recognize it and they're like, my behaviors are leading to my symptoms, then they're usually pretty motivated to do the exercises. And I'm always just like, it's just 4 sessions. Like, all you have to do is between now and August,
Right.
do these
Right.
exercises, think about these things, and it takes 30 days to build a habit, right?
Right. Which should incentivize patients more. I mean, 4 sessions, you can knock those out and like like recover your, like whatever the impediment is by the time you're done. It's like not that much effort for a lot of gain, like low risk, high reward, I would say. So hopefully that incentivizes patients to do their therapy.
Yeah, definitely.
It seems like also the recognition piece is like very key to the process of a patient like successfully getting to doing and recovering in therapy. I'd be curious to know, just because like you, I am not knowledgeable about, speech disorders, what types of different disorders there are, especially ones that people don't typically recognize, right? Ones that like may be more subtle and may manifest in different ways, like the way you say certain words or whatever. What are different, can you just educate us a little bit on like what these different types of speech disorders, impediments, whatever the vernaculars sort of look like, and maybe ones that we may not realize are even speech disorders?
Yeah, I mean, it would be a long list to go through all speech disorders.
Yeah.
At least as far as, my world that I swim in every day, the voice, people know what's normal, not normal, right?
Mhm.
And our rule of thumb is anytime your voice has changed for longer than about 2 weeks and you're not sick, then it's probably a good idea to think about getting checked out. Definitely not longer than a month, because basically, there could be sinister things going on, and there could be something that could be easily fixed behaviorally, and we don't know until we look. There is a voice rating scale. I work with a lot of grad students, so we're constantly calibrating on how do people's voices sound. Are you picking up on the subtleties of the voice? And so we think of the voice rating. A common rating scale is called the GRIBUS. So it stands for the overall grade of the voice, is the roughness. So there's different categories: roughness, breathiness, asthenia, or kind of the weakness, potentially to somebody's voice. Strain as a rating. And then evaluating pitch, evaluating their volume. And so it's pretty easy. Like once you start breaking and analyzing the voice down into those different categories, it's pretty easy to analyze somebody's voice and say, yeah, it's not a 0. 0 is totally normal. They don't have 0. So, is it a head turning voice? Like I'd give them a 3. Wow, there's something wrong with that person's voice. Like even my dad would notice, right? My dad would never notice. But even my dad would notice. Or is it more subtle, like a 1? Like only me and my student pick up on the voice changes. And so, we can pick out different features of the voice. So you could start analyzing people's voices today and be like, I hear some roughness to her voice. It's only at the ends of her sentences. It sometimes goes like a little bit low for, someone presenting as female. There's these different things that we can pick up on. Or there's something that totally is out of the blue, like tremor, where the voice is just really shaky, and and then you can pick out other features of that. Even though it's tremorous, then there's still an element of strain. There's a little bit of this sound to the voice. Yeah, just a little, I guess, insight into the rating of the voice world.
Yeah, so there are like very subtle things that only someone, educated in the field, like a speech pathologist, would be able to pick up on, like those very subtle, different, like, I don't know, nuances, I guess you would call them.
But it's not a problem unless it's a problem. Like
Right.
I could pick somebody's voice apart, but if you're not sitting in my office saying my throat hurts, why do I lose my voice, I can't get through a presentation, it's not a problem unless it's a problem.
Right.
And so people don't have to change things about their voice. It's about me giving you vocal choices potentially I could use my voice in an efficient way that I don't lose my voice. It doesn't cut out on me. I can get through all aspects of my day. I can sing or whatever, versus inefficient where, like I'm struggling with these certain things. I use the pick up the box analogy. You can do it with your back or you can do it with your legs. And I'm all about helping the person do that in an efficient way so that way they can meet all of their vocal demands. If we do something too much inefficiently, lifting with our back, we throw it out. We can't participate in all the things we want to do necessarily.
Yeah, I'm so glad you brought that up about the piece that it's, not critical. Someone doesn't have to go out and fix their voice. I mean, of course, throat cancer, like, there probably are things that are more critical care type situations where patient needs to do it. But I like it. And so I currently work in a dermatology office, and it's similar. Whereas like the type of dermatology we're doing, it's not as medical, but it's more cosmetic, right? So patients don't have to be there. They don't have to get those procedures done. It's a lot about how integral the skin, the voice is to your self-confidence and the way you carry yourself and present yourself to a crowd or to, out in public, out in the world. And so it's healthcare settings like this that can actually, I don't know, be the most impactful because you're literally changing somebody's life. This throat or, speech impediment that they might have might be holding them back from so many different things and for how they see themselves.
Their quality of life, literally.
Right, their quality of
how
life.
They do their job, how they interact with their family.
Exactly. So it's settings like this where you're not providing them with a medically critical support, but you're, supporting them critically to like their best self, right? So I just find that to be interesting where it's not always a critical, it's not always a necessity, but it's essential to their like well-being and lifestyle and quality of life. So a lot of that can be the most meaningful.
I'd love to hear more about the different kinds of exercises and homework that you give your patients. I was in speech therapy as a kid. I know this is different work than what you do, but it was to treat my pronunciation. I think it was R sounds and PH sounds and W's, and then also stuttering. And they used to give me homework where I had to like move my tongue in certain ways, move my mouth in certain ways, and I hated it and thought it was super silly and didn't like doing it. But I do think it helped over time. I also think I kind of just grew out of it. So I would love to know like what are the different exercises you prescribe to your patients, and also if you ever encounter any issues that are maybe sort of in people's heads and have to do with the psychology of how they think about how they speak.
Oh yeah. Oh, that's a big one. Yeah. Well, there's no one size fits all with exercises. The way, just my general approach to voice therapy, if assuming somebody's there to work on their voice, both how it sounds or how it feels, what I always tell my students is like, there's a whole library of voice exercises. You could look them up right now, you could do them, but it's doing exercises with the intentionality, understanding how the system works and what's affecting what. So I'm always like, okay, what is this patient doing in front of me right now that needs to change about how they're using their voice? What's inefficient about how they're using their voice that's leading to their complaints? And there's lots of different tools to help us achieve that. So let's just use an example of somebody who, comes in, they have some roughness to their voice. This is potentially how I talk. And so, we break it down. I teach a lot with the grad students. So I'm like, okay, well, how is that person using their breath? How is that person using their resonance? They're using a lot of strain. We've already analyzed and touched their throat. Like we know that they're using a lot of muscle tension to produce their voice. So what about those systems, the respiration, their resonance or placement of their voice, or how they're posturing their throat? Like what's a tool that we could use to potentially get that patient to behave differently, right? And there's so many different options. I mean, I'm saying that and y'all don't know any of them, but like one of my favorite weight exercises in my toolkit, this is called the tongue out trill. A lot of singers do them. I'm going to stick my tongue out and then I'm going to vibrate it and make a sound. So hopefully that's picking up the sound on the recording. It's an exercise that essentially forces people to get on their breath. You could mute your mics and try it while I'm doing this. It forces people to engage their breath. You also have to be pretty relaxed in your throat to be able to make that sound. So it kind of just instantly unloads tension. And I'm aligning kind of their resonance to sit up in the mouth. We want, rather than having a resonance or placement of the voice that sits back here or like lower down in the throat or be too nasal, right? So a voice resonance that sits in the mouth. When I do that, you're essentially obligating that patient, if they can make that sound, to have a resonance that sits up in the mouth. And I could have chosen other exercises to help us achieve that. There's a whole bunch of different options out there. But that's one quick and dirty exercise. And then we have to obviously, like, you can't run around all the time. A lot of times people are like, wow, my voice sounds a little better afterwards, but I can't stop and do that. all the time. And so it's building in like, okay, the exercise got us to change the system. How do we eventually change that into, I can talk, I can give a lecture, I can teach, I can do all these different things while I maintain that. And so we use exercises sometimes to facilitate that. So that might look like, I like right before I talk. Hi, how are you? I might on the sentence. Hi, how are you? I maintain some of that physicality of the exercise as I go into talking. I'm a big fan of, just in general, if you want a piece of advice, like if you're about to give a presentation, warm up your voice. Actors and singers warm up their voice, so that way their voice is ready and reliable. Anybody can warm up their voice before they give a presentation too, or a lecture. Doing that sound, or even just a simple humming for 3 to 5 minutes beforehand. It brings blood flow to the vocal folds. If there's mucus on their folds, it can thin it out, vibrate it away. The voice will be much more reliable for that person if they take the time to kind of warm up the system, just like actors and singers would. So I guess that gives a little bit of insight into the therapy component. It's never one size fits all. There's a lot of exercises out there. Voice therapy used to be pretty hierarchical, like, you have to go from sound into sentence and then into talking, and then you can eventually get to like real life. But that's time consuming. I've got 4 sessions to make my patient better. I gotta create buy-in so that they come back for the next session. Like, we don't have time to mess around. I gotta get them sounding and feeling better in the shortest amount of time possible. And so whatever we need to do to help facilitate them getting their efficient voice, that's what it is. I literally had a woman the other day that I was trying some exercises with her, and it just really, like, nothing was really clicking. And she kept saying the sentence, not really. And whenever she said not really, her voice just sounded so good. It was like something about that just made her throat relax and her best voice came out. And we shaped an entire session on her being like, not really. And then she would intermittently say that, and then we would talk about other things, and then it would start to get away from her, and I'd be like, I'm like signaling to her, like, ooh, do the thing, and she's like, not really. And then her voice would kind of reset. And there's no one thing that is going to click and work for everyone. It's just about what gets us there the fastest. Of course, well, when it comes to the articulation stuff, sometimes drilling is just really important. Like, you need to put your tongue here, and you have to say it, and you have to do it over and over. There's a motor component, right? Like, our bodies have to practice doing the thing. Just because I tell you all to talk from your mouth doesn't mean, like, talk with your resonance or your voice up in the mouth, not let it kind of sit back in the throat. Just because I tell you that doesn't mean it's going to automatically happen. So we have to practice rehearsing. Your body has to go through the physical motion of kind of just hitting the hammer and the nail on the head every single time. Like, okay, I'm doing it. I'm doing the thing again. I'm saying my R's correctly. I'm not really. I'm relaxing my throat. Not really. I'm getting back to that sweet spot. But the more your body rehearses that, the better it's going to be. The more, these are just principles of motor learning. We don't get better at playing piano by helping. We play piano. Sorry, can you ask your psychology question again?
It was just how much of patients' issues do you think exist in their heads versus the actual mechanics of their vocal system?
They're very interlinked, and a lot of times people don't know it. I mean, it's amazing to see on clinic. People will come through and we'll ask them, like, are you worried you have cancer of your throat, right? And they're like, yes, I just want to make sure I don't have cancer. Someone in my family had cancer in their throat. And the moment they find out that that's it, that they don't have it, their voice gets better, right? Like, the mind is so powerful. And of course, it's not in their head that's causing the voice. Like, in their head, they think that there could be an issue, but that's causing tension in the throat. There is a physical component, right? Like, that's just preventing them from optimizing their voice in that moment. And then once that worry's gone, the throat muscles can relax. So there is just that component of, like, well, do we trick the mind? Do we trick the throat? Oftentimes when we trick the throat into relaxing over and over, then that piece goes away. And then you can get all into the psychology of why people don't practice. And some people are, have secondary gain for having voice issues. But yeah, the mind is a really powerful thing. And sometimes, yeah, in therapy, we're navigating that. And every once in a while, you have to give a patient a push to be like, do you ever talk to a therapist about this? Because I think that could be a barrier to us continuing to make progress. And voice is a really vulnerable thing. A lot of emotions are caught up in it. And sometimes people have been through trauma that has sent their voice into the issues. And maybe that's a skill set I don't have the tools to unlock. So fortunately I'm able to refer people to other providers that can potentially help them.
Are there ever situations where you combine the speech therapy aspect with more of like, the psychology behind it, like, some sort of other therapy especially for maybe kids that have had the speech disorder impediment since birth? Do they ever need, like it is very emotional, as you were saying. Is there ever any like sort of like dual therapy they need to like not only help them be able to speak or make the sounds as they should, but also just to get over the hump of like, this is something I've struggled with for so long. Maybe they've been teased about it. Maybe they've been bullied about it. Is there ever like a therapy from multiple sides approach?
There can be, but I do have to be careful to stay in my lane as a provider, right? Like I haven't taken psychology courses, or I don't want to presume that I know how to manage somebody from an emotional, mental perspective. I definitely have the skill set to be able to help them from a voice or potentially speech perspective, and I understand all of the baggage that could potentially go with that. So I just try to navigate that to the best of my ability, watching out for, was that a triggering thing? I work with adults for the most part. So I just ask for patients to be honest and say, what, if you feel like we're making progress, great. If you feel like things are getting a little bit sticky or not feeling as good, just be honest with me, because we can change activities. I can refer you to other providers. People are here of their own free choice, right? So I want it to be a good experience and feel like we're reaching and achieving their goals, or we're at least working towards that. And if there's barriers to that, then we have to figure out how to get them help in another way.
I think one change that we're seeing a lot in healthcare generally is the rise of telehealth, especially in the post-pandemic world. Do you feel like speech pathology is something that can be done effectively over video conference or just virtually in general?
Prior to the pandemic, I didn't do telehealth because I kept asking Northwestern to set it up for me, and they said, no, we can't do it. And then they figured it out within 1 week of the pandemic starting. And fortunately, everybody else did too in the speech world. And now that we went through that, we have tons of literature of studies proving that telehealth can be effective for voice therapy. Obviously, it's in a video format. Is it ideal for everybody? No. In an ideal world, we have a choice, right? So for certain people, I'm like, I want to see you, like your whole body. I want to see how you breathe. I want to be able to do certain exercises or feel your throat and, teach you some hands-on approaches. But for a lot of people, we can just see each other. And whatever gets you to the therapy and keeps you motivated to keep working is the best option. Telehealth is great. People don't have to come downtown. People come from all over the state of Illinois to see me, right? And if people have to take off work, that means they lose money. If they decide not to come and they don't cancel their appointment, then I get a no-show, and then our clinic doesn't generate the revenue. And so it's created a lot less no-shows, basically, because all people have to do is be like, hang up their last call, hop on my call, and then they're there and they're able to participate. Some people, especially the gender affirming voice population, they feel self-conscious leaving the house. They don't want to do that every time. And also, so I do a decent amount of what we call respiratory retraining. I work with people who have kind of upper airway obstruction, where their behaviors are, they're literally closing off their own throat and have difficulty breathing, for example, during exercise. And so with telehealth, it's really cool. I can teach them the techniques while they're on the treadmill. I can teach them the techniques while they're on a run and a jog, and I'm in their ear and saying, okay, do this. Okay, try this. Talk to me. What's going on? What are you feeling? Whereas around the office, they're going to run right back and forth in my tiny office, or we go to the stairs, and that gets really boring really fast. And so telehealth has really changed the way we do things. And then even from an educational perspective, I record a lot of telehealth sessions, and then my students can go back and analyze them later, as opposed to if you're not there, you're not there.
Could you?
I was wondering. Oh, sorry. You go ahead.
You mentioned from the gender affirming care perspective that you actually do work a lot with a lot of those patients. Could you explain how that process works? I know you're talking about a bit of exercises from the more general like speech disorder standpoint, but what would that process look like for, any of our young listeners that may be considering something like that? What would that process look like for them?
Yeah. Northwestern Medicine has it's called the Gender Pathways Program. And it's basically an entire network of providers that are sensitive to gender affirming care. It can be anything from obviously somebody like a voice therapist on the team when someone wants to change how their voice presents, up through just having a dermatologist, an endocrinologist, a reproductive specialist, people who perform all of the transformational surgeries that are offered. And so it's kind of a one-stop shop to be able to be in touch with a provider. Rebecca Seabree is the main coordinator. She's a social worker and says, okay, so what are your transition goals? And then she puts the patients in touch with providers that could potentially help them. And so obviously our voice team is part of that program. And the majority of patients we see are people transitioning from male presenting to female. And so the goals that go with that would be raising pitch, just trying to sound more feminine, or sounding potentially just more gender fluid. I do have a few patients who are trying to masculinize their voice as well. And so we can do that from a behavioral perspective, working on pitch awareness, increasing somebody's range, decreasing we have potentially physiologic limits, but behaviorally developing people's awareness. How do we get you to be aware of? And pitch is kind of one of the easy big targets to go after, but there's also other aspects of speech and voice. And did you know that all those filler words make it sound more femme? And I know you're not wanting to sound as femme, so maybe don't say like so much. And and their voice therapist and their speech therapist, I can tell them these things, right? And so we're working on, well, how do you? It's overall communication, right? Like how can I help them communicate more in an affirmed how they're wanting to present? And then there are medical and surgical things that can be done with our physicians that are potentially like a big surgery. There's something called a Wendler's glottoplasty, where the surgeons take the vocal folds and they demucosalize part of them and then stitch them together. So shorter vocal folds equal basically a higher pitched voice. And so that's a surgery if we're not meeting therapeutic goals, or the person's like, I just want a surgery, I don't want to have to deal with the therapy, then potentially that's a surgical option. We are currently examining the effects of direct testosterone injections into the vocal folds. Testosterone lowers the pitch, and we know that patients who start on systemic testosterone with creams or with injections, the vocal folds thicken, thicker guitar string plays a lower note. And so a lot of people's voices drop, but we want, some people don't want all of the systemic side effects of testosterone. And so we're actually running a study on people who are testosterone naive, who have never had testosterone and want to have a more masculine presenting voice. And so doing a series of injections directly into the vocal folds to change their voice.
I had a question about someone who's interested in going to grad school for speech language pathology. What is the best way for someone to show interest in the field, and what are some things you recommend before applying to do?
Mm-hmm. For sure, start observing. Spend time observing SLPs. We're, like I said, we're all across the healthcare field, working with traumatic brain injury patients, people who've had post-stroke, working with little kids, people like me. And so just spend time observing. It's actually a requirement for graduate school, or most graduate programs want you to have done 25 observation hours. It's part of obtaining that degree. And so I think that's really smart to do that. So that way people kind of know what they're getting into. And it's not just like, I have this, in theory, I want to be a speech pathologist, but I don't know, I've never seen it, what a speech pathologist does. It's a great way to get a sense of, this is something I could see myself doing. I could see myself working with this population or this population. So that would be the first thing I would definitely do. There's also a lot of online programs. There's an Intro to Communication Disorders class that's out there. It's a requirement of the degree, and that's a great exposure for a little bit of a deeper dive into what the magic behind what's going on. Could I see myself in this population or this population? And so just taking one online class is a great educational opportunity for that. And then if you know speech pathologists, you could always just do an informational interview with somebody, find out their path that they've been on.
Thank you so much for this. This has been super interesting. I learned a lot. And so to close us out, I was hoping you could tell us one misconception about vocal health or the speech pathology field in general that you would like everyone to know about. Or if you can't think of that, just what would you like the average person to know about speech pathology?
Ooh, that's tough. I mean, I guess my perception of speech pathology was always, it's helping little kids with their R's, just like you said. Well, and we do so many other things. It's a really rewarding field. I never, obviously growing up, pictured myself doing this, but I feel so rewarded in this field to be able to literally help people every day. I help my patients every day. The U.S. News and World Reports always rates it in like the top 25 happiness life scores, or people job satisfaction. That's what it is. The job satisfaction scores. It's always rated very highly, and I can see why, because you're literally helping people with their problems every day.
That's so great. Yeah.
Well, thank you all so much for having me. It was great talking to you.
Yes, Jonelyn, thank you so much for coming on today. We really appreciate you taking the time to talk to us and share a bit of your expertise and your journey. It's been such a pleasure.